Here's a standard induction for intubation as a CRNA. Once I have my drugs and airway, I'm going to do my machine check and check that my suction is functioning. Once we're in the room, I'm going to connect the blood pressure cuff, the EKG leads, and the pulse ox. Then I'm going to cycle the blood pressure cuff. While my blood pressure cuff is cycling, I'm going to pre-oxygenate the patient with the mask and circuit. Then I'm going to connect the drugs to the manifold and get my airway set up. Standard drugs for an intubation of a healthy patient include a sedative, an opioid, and a paralytic. I will place my hand on the mask in the C3 position and then check my end tidal O2 for proper pre-oxygenation. Once that has reached 60 to 70, I will begin to push my drugs. I will observe the patient's respirations and loss of their lash reflex. Once that disappears, I will grab the tape from the mask and tape their eyes in order to protect their corneas. I can mask ventilate the patient at this time, and in order to intubate them, they will need to be paralyzed, so I will go ahead and push my paralytic. After being properly relaxed, I will grab my blade and DL the patient and confirm my view with vocal cords. I will grab the ET tube and then place it between the vocal cords. Here is a view of intubation with the video scope, so you will scissor the teeth, place the blade in the mouth, and pull up. Once you confirm the view of the vocal cords, you will place the ET tube between it and then pull out the stylet and inflate the cuff. Here is an example of human vocal cords and what it would look like. Once you've placed the ET tube between the cords, you will take the blade out of the mouth, pull the stylet, and put up the cuff. Then you will connect the circuit to the ET tube and manually ventilate the patient. You will confirm continuous end tidal CO2 as well as bilateral equal breath sounds. You will note the depth of the tube and then tape it in place. The tape will act as an anchor so that if anything tugs on the circuit, it will tug on the tape and not dislodge the tube. After you've turned on your ventilator and your gas, you can place a temperature probe because that is one of the vital signs that we monitor. And now you are ready to begin your case.